When treating Perthes disease, we follow the principle of containment, which aims to keep the ball contained within the socket and maintain the hip's range of motion as much as possible, so that as the ball heals, it is molded into a matching pair with the socket. But sometimes a few key muscles can become so tight that they prevent the leg from having its full range of motion. When this happens, we may recommend a tenotomy, or the cutting of a tendon, to restore motion and containment to the hip. Once your child is asleep under anesthesia, the tendons of specific muscles, called the adductor muscles, are cut through a small incision in the thigh. This is a minimally invasive procedure and should help improve the range of motion in the hip. Often, a tenotomy is combined with casting. To learn more, contact the Orthopedics Institute at Children's Hospital Colorado by calling us, or visit the website by clicking the links below.